Welcome to Innovation and Leadership. I'm Jess Larson. On this episode, we get to have another mini-series episode of Longevity for Investors with my great co-host, Greg Bailey. If you don't know Greg, he is founder and chairman over at Juvenescence, amazing company with a number of different approaches on increasing health span, and previously helped grow Biohaven. They were able to sell the drug Nurtec for $11.6 billion and are still trading on the stock market. Last time I checked, about $3 billion. And previous to that, helped grow Medivation. And their cancer drug Xtendi was famously sold to Pfizer for $14.3 billion. And previous to that, medical doctor from back home in Canada, where I grew up, and where our great guest this week, José Navarro-Betancourt, did his PhD at McGill University. Jose, thanks for doing this.
Thank you for having me.
So, Jose, medical doctor, PhD, lots of work in longevity science, and a leader over at Quadroscope, another venture capital fund targeting the hallmarks of aging, and early stage company supporter going after longevity and health span. I'd love to start with whatever I missed. Tell us the highlights that I didn't cover.
So let me start with a brief intro of how I got involved in the field. So, as you said, I went to med school. In the halfway through med school, I got really interested into stem cell research, in particular using stem cells to treat cardiac failure, so cardiac progenitor cells. And that's how I got involved into cell culture. And at the time, it was mind-boggling that you could actually keep cells alive outside of the body, right? That's very crazy. And at the time, stem cells were kind of popular because Dr. Yamanaka had just won the Nobel Prize for induced pluripotent stem cells. So that was really cool. So I did that work, I got familiar with the lab, and then in my last year of med school, I had the opportunity to do clinical research we were specifically looking at insulin resistance in patients with obesity and polycystic ovary syndrome, which is a condition associated with insulin resistance. And we were measuring insulin resistance in using insulin glucose clamps. And this is, by the way, the most accurate way to measure insulin resistance. So I was really getting involved into all the things that get wrong with aging. And after finishing med school, I decided that I really wanted to take a deep dive into mechanisms of aging. And I specifically chose to work on protein quality control processes at McGill University. And we basically did experiments in cells and in animals, in mice, to understand how these protein quality control processes contribute to health and disease. And halfway through my PhD, I became aware of the whole apparatus that's in place to translate basic science, these basic discoveries into real cures for patients. And I wanted to be involved in that ecosystem. And now, as you said, that now I'm the scientific director at Quadroscope, and Quadroscope is a venture capital fund that invests in healthcare companies developing pharmaceuticals, diagnostics, software, equipment, and devices, enabling biological age reversal for disease treatment, prevention, and longevity as well.
That's so great. Well, we're going to do a little bit of a different format this time. Greg Greg's going to take the first half of the interview for the next 20 minutes, and I'm going to take the second half. Greg, I'm going to turn it over to you.
Wow, all that pressure. Jose, thank you very much for being here. Very exciting what you did both at med school and at your PhD, and now what you're doing investing. The two aspects that I really like to unpack with you is one, I think there's so much confusion about stem cells. And I think that our audience is more investors and people interested in longevity than scientists. So if we could unpack that a little bit together. The other big one for me, is to try and inspire people that you don't need an MD and a PhD like you have to invest in biotech. That, it's got some simple principles. So how you think about investing in biotech, and how you'd advise somebody who doesn't have an MD and a PhD to think about investing in biotech. But let's start with a much confusing area of stem cells. You mentioned progenitor stem cells, and you and I know that they're very different from a number of other stem cells. So if you were going to describe what's going on in stem cells, there's a lot of treatments out there right now, which I think are rubbish. I don't know what you think about, because they're stem cells that basically get destroyed in 2 days to 2 weeks. So how do you think about stem cells, therapies today, where we're headed, and sort of a brief overview for our audience?
Yeah, that's a very good question. So the main challenge with stem cells today, in my opinion, is the source of the stem cells. We don't know if where do you want to take them from the bone marrow, from the fat, or maybe you want to take them from skin and make them into a stem cell that can convert into any other type of stem cell. So that's one problem. Then the next problem is, do you want to use your own stem cells, or do you want to use the stem cells from someone who's younger and where the stem cells work better? So there are a lot of procedures or approaches to kind of standardize the quality of the stem cells and to perhaps even improve the function of the stem cells. Now, as you said, to my knowledge, no one has definitively proved what is the best approach to stem cells, and it becomes kind of like going to a very nice restaurant, right? When you go to a very nice restaurant, you may have like the best ingredients and the best chefs working on them, and you may get a great result. You may heal your knee osteoarthritis with your inflammation and degeneration of the cartilage in the knee. But you might go to like a so-so restaurant. The chef was having an off day, and you may not get the benefit that you were supposed to, and that's a big problem, right? You cannot really guarantee results, and that's something that the FDA really doesn't like. You need to offer a standardized product. Now, where I see the field going forward, it has become clear that once you inject cells, most of them disappear. They don't engraft. That is, they don't stay alive in the tissue where they are supposed to stay. But they produce a large amount of protective proteins and other molecules that help sustain the tissue and help repair the tissue. And in theory, you can isolate these factors, if you will. This is kind of jargon, but it's a good word. All the proteins that they produce, and then you can isolate them and then inject only what the cells produce. So you end up with a treatment that is more straightforward to standardize, and in theory, it's as good as having the cell, and it's a product that you can that is universally compatible, and it's off the shelf. And that's really what you want. You want a little vial that you can inject. We have a company working on that called Immunis. They're using the secretome, that is everything that a cell produces. and they're using immune system stem cells, isolating the circuitome and using it to treat muscle wasting and now metabolic diseases like obesity. And we can talk about all the companies in our portfolio. We have 13 companies, and they are targeting different mechanisms of aging.
Most
And
of
now the
stem
second
cell.
question of
Sorry, you go ahead.
now the second part of your question was you certainly do not need an advanced degree in life sciences if you want to become an investor in the field, right? You really don't. But you need to try to put in a little bit of work in order to understand some terms and to basically understand the framework in which you kind of assess these kinds of companies, what questions to ask. And yeah, we can happy to talk much more about that.
Well, I want to pursue that as well. Basically, I'm not sure about necessarily getting young stem cells. I want to get them from Keith Richards and Willie Nelson, because whatever they're doing seems to be working extraordinarily well. But on a more serious note, the difference right now is most of the treatments that people go to Mexico and the Caribbean for are mesenchymal stem cells, aren't they? Not progenitor stem cells. And what are your thoughts on mesenchymal stem cells?
Yeah. So mesenchymal stem cells are kind of a type of adult stem cell, if you will. So this is a cell that a mesenchymal stem cell is a cell that has kind of committed to becoming one of the three layers of the embryo. And this, I don't want to get into the weeds here, but the thing to remember is that these cells committed to becoming muscle or cartilage or fat, and the thing with mesenchymal stem cells is that in theory they are safe to use because they can only transform in those things. They cannot transform into something like a bone or something that will, in theory, reproduce uncontrollably and cause cancer. So that's the main reason, in my opinion, for using adult stem cells, the safety.
But I don't think they engraft, and I'm not sure how robust the secretome is, the proteins you talked about. But on the investing, so if, my theory, this worked very well for me, was find 7 to 10 drugs that I thought were exciting, find a good management team, and the 7 to 10 had to be differentiated, diverse, not all on the same platform, adequately capitalized, have great management, and they got a very good chance of hitting it on one of the drugs and hopefully 2. What do and so you don't even have to really understand, because that's the same. I don't think you have to understand how to build a Tesla car, but you still can invest in Tesla. So if you were telling somebody who, what they should look for, that your group looks for, and it's very important that this team has these qualities or the company has these qualities, what are they?
That's a good question.
It's 2 good questions.
Let me break it down in 4 things we look at when evaluating a company. As you mentioned, the team. The team is really important, especially in early stage where a lot of the science is unknown. So the team, the ideal founder is a serial entrepreneur who has done it before. Now, that's not always possible, and you have to give new entrepreneurs a chance as well. But the team needs to show expertise in the domain that they're working on, and as you said, a certain level of management experience, because this means that they will be able to pivot and face the challenges. Now, an important thing about the team, they have to be very good at communicating. They really need to be able to abstract a complex concept and boil it down and present the vision of the future to investors. and that's really key. This means that if they are able to do that, they will likely be able to get funding in future rounds, and it's also nice to deal with people like that, right? Even if you don't have a technical background, they teach you basically, and and you end up feeling that you don't understand some things super technical. You won't understand them, and maybe you don't need to, but you understand how the competitive advantage of the technology on a high level, and that's important. Next, the science, the science. What you want to make sure is that the science makes sense in what is known in the literature today. I mean, these companies are at the forefront of science, literally. But so there's many unknowns, but you can identify that they fit in the framework and the understanding of biology. Next, the clinical development plan. They have to be able to identify the patients that will benefit the most from this technology. And this includes the most efficient way to carry out a clinical trial and prove safety of the technology, prove that the technology is useful, and then bring it to market. And then once you bring it to market, it's possible to perhaps use it off-label for other indications, and for preventive or preventative purposes as well. And I want to go back to that, to prevention. And then the third one is, I mentioned it before, the competitive landscape. You need to be able to understand how the technology is different from the current standard of care. Is this even a disease that needs a very big improvement in the standard of care, right? Is this a good priority? And the founder needs to be really aware of how the technology fits. And obviously, you have to think 5-10 years from now, because this we're talking about early stage companies. They will compete in the market 5 years from now, in theory, or more. So you have to have certain of a future vision. And so those 4 things: team, science, clinical development plan, and the competition. And the thing that I wanted to cover also is perhaps you are new to investing in longevity biotech, but you are somewhat familiar with biotech, right? And I want to highlight two key differences between regular biotech and longevity biotech, because I mean, longevity biotech is still biotech, right?
Yeah.
So the first difference, in my opinion, is that in longevity biotech, treatment can have multiple applications or clinical indications. This is really rare in traditional biotech. You have a company working on treatments for lung disease, for cardiovascular disease, brain diseases. But here, the same treatment may be able to be used for different indications. So right away, that's potential for having a blockbuster drug. Most blockbuster drugs today have multiple indications. But anyway, we can dive into that later. And then the second aspect that I touched on briefly before is the preventive or preventative aspect of the technology. So in theory, you want to be able to use these treatments in patients who are old, but who do not have a clinical disease, and this in theory will prevent aging and age-related diseases in the future. Those 2 things.
I think we're very lucky, Jose, and Jess is certainly aware of that. And that's, you need to understand the competitive landscape. And unlike almost any other industry you're asked to invest in, we know where all of our competitors are because they have to register with regulatory bodies. So no one's working in a garage in Iowa and it's going to, knock your company that's, working on the secretome out of the box. you know they're coming. So that gives a huge advantage to investors. And then everything else you said, I 100% agree with. And the prevention, I think, is a big, big deal. So I give you 10 million today to make one bet. Where would you bet that you think you have the greatest chance? And I'll give you the option of giving me two sectors or areas, and if that's where you'd place your bet because you think this is going to be an extraordinary upside, and I think that my risks are mitigated. Good luck.
Yeah. Let me let me choose three technologies that I'm personally excited about, because I mean the key with a good portfolio is to diversify it, right? Diversify it in targets and in stages of the technology as well. So I think I'm really excited about treatments targeting inflammation. So chronic inflammation is a hallmark of aging, and actually multiple mechanisms of aging converge into chronic inflammation. So I want to unpack this a little bit because the audience may not be very technical, but inflammation is a process that the body uses to repair tissues to face an injury. But uncontrolled chronic inflammation is really bad for tissue function in the long in the long term. And the advantage of targeting inflammation is that it is really an unmet clinical need. Different diseases of uncontrolled inflammation lead to fibrosis and then loss of function. And even Alzheimer's disease, now there's the inflammatory component of inflammation, of neuroinflammation is recognized for Alzheimer's disease. And the key thing with inflammation is that you can easily measure it. You can measure inflammatory molecules or proteins in circulation. So you really can have a parameter to follow up and see that your treatment is working. And you have diseases that can be treated in a relatively short time frame. For example, fatty liver disease or osteoarthritis, pulmonary fibrosis. Those kind of disease that may or may not give you shorter endpoints. So that's it. Inflammation. Second, epigenetic reprogramming. And this is a lot to unpack, and I really don't want to lose people here. But cell reprogramming is basically a technology that tells your cells to behave like they behaved when they were younger. So it's essentially the holy grail of longevity biotech is cell rejuvenation, and there's literally billions of dollars invested in this technology. So that's important. You have to pay attention to that. Today, most of the treatments for cellular reprogramming are using gene therapies in any variety of ways, viruses, mRNA. We invested in Turn Bio. They're using mRNA. And an emerging technology that people should pay attention is chemical reprogramming, which is using drugs that you can either perhaps take orally or inject to the body. Have to pay attention into that. And then the third one is related to my PhD research. It's biased, right? It's protein folding, protein quality control processes. The technical jargon is proteostasis, if you want to look it up. And specifically, I would like to see more work on how to maintain the quality of long-lived proteins, including elastin, collagen, proteins in the extracellular matrix, and how to help cells degrade all the proteins that are damaged and need to be replaced. And if I want to look forward into the future, I would start paying attention to targeted protein degrading. Like you want to degrade the specific parts of the cell that are damaged. For example, mitochondria, the part of the cell that produces energy, or the endoplasmic reticulum, which is the part of the cell that one of the parts of the cell that produces proteins. So you can basically degrade specific things that get damaged, or even this is really cool, or even things outside of the cell. You can kind of trick the cell into eating proteins outside of the body and eating them, and then removing all the damage. There is a company co-founded by one of the Nobel Prize winners in chemistry, Dr. Caroline Bertozzi. She won the Nobel Prize for click chemistry, and now her company is using degraders of extracellular proteins to trick cells into eating damaged things outside the cell. I think those three things I'm excited about.
You did a great job. I'm gonna on that. Jess, take it away and on the various subjects. And I think you've got certainly three of the big ones. And interestingly, we know with Ozempic, the GLP-1s, diabetes / obesity drugs, they're $100 to $150 billion in annual sales is what they're projected. If anyone hits on any one of the three areas that Jose you've mentioned, they're $500 million a year. I mean, you just create one of the biggest corporations in the world because it is that profound to humanity. Over to you, Jess. Profound to humanity.
Yeah. Well, prepare to be underwhelmed, everyone. Greg is their international globetrotter and on flights and off flights, so we'll let you sign off, Greg. Thanks for joining us today.
Thank you, Jose.
Jose, I think about the investors that I'm talking about for our venture capital firm we're looking at starting, and the success of Ozempic and the GLP-1s are hugely interesting to the big pharma companies, to the big funds, to the individual investors. But there's still some things misunderstood about it. Why don't you weigh in on them and kind of your feelings and maybe insights that not everybody knows?
Yeah. So that's a great question, Jess. So how did all the craze for obesity treatments begin? And we have to take a throwback to the summer of 2021, when the FDA approved the Ozempic, or Wegovy, for the treatment of obesity, or as the FDA calls it, chronic weight management. This was a big deal because it was the first drug approved for obesity in 7 years. Since 2014, the first drug. And the really thing that I want to highlight is that why is treating obesity an important thing to do? Because it essentially prevents all sorts of bad cardiovascular outcomes, including heart attacks, stroke, and those are basically the kind of causes of death in developed countries. And so people end up with the idea that you need to prevent diseases. And obesity is actually a disease as well. It's an inflammatory state, but you get the idea. It's not as bad as a disease as having a heart attack. And I think this awareness will really move the longevity field forward. That it's okay to proactively treat serious disease before it happens. Now, what's the problem with all the available treatments for obesity? The problem is that you lose weight and you lose muscle as well, and that's a big problem in older patients, because if you may know that once you're older, your capacity for building muscle declines, right? And having an altered body composition in older in age correlates with your chances of dying sooner. So that's not good, right? So what we've seen is the trend here is to treat obesity and preserve muscle. So we call it muscle preserving obesity interventions. And a good thing to highlight here, I'd like to highlight two companies. You may have heard of BioAge. BioAge is it's a longevity company that they are working on a treatment that, in combination with the Mounjaro or Zepbound by Lilly, it can help weight loss and prevent muscle loss. If you want to Google it, is Google the strides, taking stride clinical trial. All clinical trials have cool names, by the way. People like that. So that's a cool thing. The other cool thing that I touched on at the beginning of our conversation is Immunis. Immunis, they have this secretome of stem cells, these stem cell proteins, and they are about to begin a phase 2 clinical trial using this treatment to produce weight loss. So the trial doesn't have a name yet, but we'll I guess it soon will. So that's it. And then this touches on another thing that I wanted to highlight. I mean, the single best intervention today for longevity is exercise. If you don't exercise, you should. That's the single best thing you can do for your body. But some people don't like to, or can't, or they simply don't exercise as much as they would like to. So there is a series of molecules that your body produces when it exercises, and we call this the exerkines, like exercise cytokines. But maybe another less technical term is exercise mimetics. So you kind of trick your body into thinking that it's exercising. That's gonna be a trend, I think, in longevity biotech, and it's gonna be partly propelled by all the Mounjaros and Ozempics.
So, people who listen to some of the famous voices out there talking about longevity, like a Peter Attia, right? He says, like having a great VO2 max, like you can have it's like 5 times the other things for effectiveness. Like this idea of exercise being essentially the wonder drug for longevity. And yet the gurus about exercise, I mean, there's thousands of them, and they're all like, they believe in their way like it's a religion, and it's hard to sort out for some of the rest of us of like how much is actually necessary. Do you have any guidance for thinking through, or are there any of the experts that you like when you think about not just exercise, but longevity exercise?
Well,
frequency, duration, intensity.
That's a good question. So how much exercise do you need? And the short answer is it's not clear. Like, I mean, what is absolutely clear is that if you don't exercise and begin exercising, you will get the most benefit. Now, the evidence is, as you said, it's a bit confusing. Should you do super high intensity, short periods of time? Do you want to do longer periods of time, low intensity? It's it's too. I can't really comment on that. But what I can say is that the best exercise is the exercise that you enjoy doing and that you want to do every day, right? Now, getting a bit into the weeds, there are 3 types of exercises that you may want to consider doing. So the first one is cardiovascular exercise, and this is supported by the fact of that people who have a high VO2 max, that is to say, a high capacity of burning fuel and using oxygen, have a lower risk of dying. So that's it. You want to do high intensity cardiovascular training. Now, what's the problem here? If you're not used to doing it, you really have to be careful and not stress yourself and get injured or get even a heart problem. If you're really not trained, you have to really be careful. Then the next exercise is weightlifting, strength training, and this is also supported by the fact that people who have a high muscle mass or high lean body mass have better outcomes even when they get sick, and better outcomes in terms of less chances of dying. So you want to do some weight training, and the third one is balance. You need to, especially in older patients, you want to prevent falls, and because a fall can be devastating. You break your femur, it's a long time to recover. And balance, you may want to do like yoga, some I do longboarding, skateboarding. So those 3. If you have to pick one, and this is controversial, you may argue that you should try strength training, because with strength training you may get some cardiovascular benefits if you go hard enough, or if you do if you really get your heart rate up, you might get the benefit, and you may get the benefit of stability, having a better posture, a better balance. So those 3.
That's great. Let's talk for just a minute about other longevity routines. When you think about nutrition, again, I mean, just a sea of people, all with these very strong opinions that, again, maybe more than the exercise people, this is their religion. I'm paleo, I'm high protein, I'm low protein, I'm pescatarian, I'm vegetarian, and they are so passionate without showing clinical testing or, real proof a lot of times. What are your feelings about Walter Longo and the longevity diet, or who do you like when it comes to like longevity nutrition?
I mean, this is also a very complex subject. May not be the best person to answer that question. But what I can say is that the best diet is the diet that you can follow, and that you can consistently apply and enjoy doing. Right? I mean. And also a good diet is a diet that maintains your weight. And what I mean by that is maintaining a healthy body composition and maintaining an appropriate body weight. So if you are a bit overweight, you may want to cut down on whatever you're eating. And if you have an imbalanced body composition, you may want to try to exercise to increase your muscle mass, right? Now, I tend to like diets that are. Personally, I try to eat low carb, and I try to eat clean most of them, most of the week, and occasionally I'd like to have a nice dessert, a nice or a nice comfort food, and I guess this makes it sustainable, right? I you want to be able to enjoy food. That's my take. But I mean, if you are really a high if you're an Olympian, you really want to have a perfect body, and really diet is a big component of that.
Yeah, I actually kind of hate the word diet. Diet sounds to me so often like you gotta have a lot of discipline and you're not gonna like this, and that it almost like by default means you're not gonna eat things that you want to eat. For me, like I completely changed what I'm eating. Like I had the metabolism of a 14-year-old till I was like in my late 30s, right? And then all of a sudden it switched. And so I was like, oh, apparently I'm not 20 anymore, right? And I look at like, I don't know how you feel about this, but like, I loved what you said about exercise. It's something that you enjoy doing. If you hate going to the gym, that should not be your plan. You're not going to keep that up for the rest of your life. I love that you're a skateboarder. I'm a skateboarder as well. Snowboard, surfing, talk about balance and cardio, right? And nobody has to like twist my arm. Like I don't have to like gut it up to go like, oh, well, let's go out snowboarding, right? Let's go skate a mini ramp. I'm not much for the cement parks anymore. I don't bounce like I used to. But with the like longevity lifestyle for food, this idea of like, like I have switched so much more to like roasted vegetables with olive oil and salt, and like it, and then a little like squeeze lemon over it or something, broil it in the oven. And like, it tastes so good, my teenagers will eat it. My 13-year-old who loves sugar cereal will come eat that. You know what I mean? Like, I don't have to like gut it up to eat vegetables that way, And so I'm so happy that you said that. I mean, obviously there's so many more technical answers and things, but I appreciate the advice because it's so practical.
Yeah, I mean, you have to enjoy it, and healthy food is nice. Like really, it's really possible to do it. Yeah.
Any advice for sleep, especially high achievers? This shows a lot of investors, a lot of CEOs listening to it, and it's all these things about like you should get sleep. Any tricks for actually helping yourself deliver on your good intentions? Or, like Greg, I was just over staying at Greg's at his fancy place in the Mediterranean on this island, and like that's a guy who's like built a lifestyle where he gets his sleep, and like when he's taking international flights, like he changes his schedule to go get enough sleep because of his flights and things like this. And like he's kind of a hero to me of just like he doesn't make a big deal of it. It's just his lifestyle. Any thoughts for the rest of us, like creating a better lifestyle with adequate sleep?
Yeah, I mean, this sounds like this is easier said than done, but you really have to invest in yourself and your health. You really to really be able to be a top performer, you need to take care of yourself first. You need to be able to sleep adequately. You need to be able to eat, to have some off time. You need to be able to exercise, and if you feel better, you will perform better. That's a fact. Now, some people, this is hard to do at some stages of your career, right? Not every job is that tolerant with those kinds of things. So it's really a balance. The better you feel, the sharper you're going to be. Now, sleep. Yeah, if you don't get enough sleep, you're really doing a disservice to yourself. And I've done it many times with all these the red eye flights, and then but yeah, you really need to try to move the schedule around if you can. Now, why is sleep important? It really on a high level, it gives your brain an opportunity to recover from the day, to rest. There's a lymphatic drainage in the brain. Neurons have to be off. They cannot be firing all the time, and if you don't, for example, in doctors who tend to spend long shifts without sleeping, the more you are awake without rest, you can make mistakes, and that's very dangerous.
Yeah.
Right. Anyway, those are my thoughts. You really needs to try to prioritize it as much as you can, but it's really hard. And then, should you be taking medications to sleep, which is tempting? The high level comment is that you don't want to depend on them, but if you need them for a short period of time, it's better to use them than not using them. And if you use them, you tend to have to not get into the deep stages of sleep. You sleep for a long time, but it's not useful sleep in terms of repairing. Those are my comments.
Yeah. I feel like education motivates me a lot, because once I learn what's really going on, it's harder for me to rationalize and justify to myself. And I think a couple of things that changed me a lot for sleep was I'm pretty competitive. Like I want to win. I don't care what it is. Like a sport or whatever. It's fun. And I was reading this book called Essentialism by Greg McKeown, and he was talking about sleep and how they did a study of all these different high performers, and it was like from level 5 up to a level 1 on the top. And what they found is as you went up, they slept less. So level 4 slept less than 5, 3 less than 2, 2 less than 3. But then what they found out is the number 1 highest performers in the world slept more than number 5, and that they were very protective of their sleep, and that they would, if something happened during the week, that they would like make time on the weekend to catch up and restore, and that it was just a priority for them that they weren't willing to sacrifice on. And for whatever reason, like that mental competitiveness in me is like, well, I want to be level 1. I don't want to be like level 2 or 3. And that helped me with like my temptations to overwork or to, whatever rationalization I would have to not sleep. And this isn't all the time, but I mean like as a lifestyle, right? And I think another one, I had, taken a couple of years off of finance and went to work for my consulting firm, actually. I'd been a client and then I went and worked for them. And they were letting me teach leadership classes to Navy SEALs, Naval Special Warfare. And there was one of the first female officers in Naval Special Warfare was retiring. So I talked her into coming to work for me. And so she could like teach me how to work with these clients and across DoD. And she, previous to that, she'd been a helicopter pilot for the Navy. So the Navy version of a Black Hawk helicopter is called a Seahawk, right? And both her and her husband were helicopter pilots. And when she explained to me like how serious they take sleep, and that when you're out on missions and you're doing this stuff, if you, like we always have these images. I mean, I was working with Navy SEALs. We've got all these kind of tough guys and stuff, right? This idea of like military people pushing through sleep. I mean, that community has a real problem a lot of times with seeing the ability to not sleep as a badge of honor, right? But when they're like, no, lives are at risk. If you even think you had a bad night's sleep, you need to pull yourself out and say, hey, I don't think I should be flying today. I don't think I had a good enough sleep last night. And that was just like so counterintuitive, like hardcore people going for the stuff, flying Seahawk helicopters. And this idea, like the people who had really learned it fully were saying, nope, like we're the best of the best, and we're not going to risk things by having the pilot not have enough sleep. And for some reason, like it was just like seared into me a bit of like, oh, maybe I'm not thinking about this right. Maybe it shouldn't be a badge of honor that I can pull an all-nighter and stuff. So I don't know if you have any thoughts or comments on any of that.
Well, I mean, for a Navy SEALs, for a Navy Seahawk pilot, it's obviously a life or death mission sometimes, and you really want to be at the top of your game, and for yourself and for others, for your team, right? So it makes sense that if you say, "Hey, I'm not feeling well, let's someone else has to do it." That's important.
And I think what it was is the culture. Like, of course, anybody could say that anytime, but they had a culture where that was embraced. That wasn't a sign of weakness. That wasn't the exception to the rule. That wasn't the like, it's like technically companies have whistleblower clauses, except that whistleblowers have like a huge chance of getting fired and ostracized, right? This was a culture where it's like, it was perfectly acceptable to be like, yeah, I don't think I slept well enough. I'm not flying today. It's like, wow.
Because I think that on a deeper level, they feel that they belong to something greater than themselves, right? And there, I mean, you want the whole team or the whole organization to succeed. Not only you're not like a show of like, hey, I'm going to be the best pilot. No, I want the whole team to be good.
Yeah. Can we actually touch on that for 1 second for longevity? Like community, having a meaning in life, having a purpose to life, leaving a legacy, and like happiness and like long-term joy. I don't mean short-term fun, but like those kind of things, and how, those communities essentially of people who've lived past 100 and how prevalent some of that stuff is.
Yeah, absolutely. So let me start by saying that depression is a risk factor for having a bad outcome in most diseases. In cancer, in cardiovascular disease, in the older age, if you're depressed, you have a higher risk of dying, and that's interesting because depression happens in two moments in life, and when either when you're very young and you're still finding your place in life, your purpose, and then in older age, by a number of reasons, right? Your family or friends start dying. You're kind of alone. Maybe you're retired and you don't have anything that interests you. It happens, right? So obviously having a sense of purpose, having something to look forward to is important. Then the community is important in a sense that we are social animals. It feels nice to have to share things with people, to have people listen to you, to be aware of what other people are up to. It's nice, and the good thing about the community in the longevity aspect is that a community kind of helps you make healthy decisions. Because I mean, you share information, you share perspectives, you encourage each other. It's kind of like a life, like a nice healthy club. And now there's a deeper aspect into the whole psychology aspect called psychoneuroimmunology. So this is a discipline that studies how the brain and cognition kind of affects the function of the immune system and the endocrine system, the system that controls your hormones. So it is clear that people who are stressed, they basically, or depressed, have a high level of stress hormones circulating in the body. It's not good. The body's kind of like scared, like in a fight or flight mode, and then the immune system starts suffering and starts maybe getting a bit dysfunctional, and maybe a cancer, and maybe they let the immune system lets a cancer cell escape, and that gives you a very bad disease like a cancer, or it activates autoimmunity. And so this is a really emerging field, but people are looking into all the consequences, the organic consequences of depression, which we'll see how to move the. We're paying attention to that and looking forward to results.
Any experts that you like there, or any schools that you feel like are further along than others, or anybody?
I don't have a name that comes to mind at this point, but I guess that the most or the classical example of neuro psychoimmunology is immune dysfunction and depression, or even more basic than that is stress hormones, or in patients with major depressive disorder. And depression is just a little. It's just a component of mental health. Schizophrenia, bipolar disorder, all sorts of very unfortunate conditions.
Yeah. Maybe another direction too. When you look like supplements and clinical medicines, so many doctors are not, they don't get extensive nutritional training, and they can't keep up on all the new, or they are not keeping up on all the new longevity breakthroughs and things like this. When you can go to like the pharmacy and there's all these like things that say anti-aging on them on the bottle, but there's no clinical evidence, and then later a bunch of them get proved to really not have an effect. It's easy to get skeptical, and it's easy to get overwhelmed for somebody like me who is, like, I'm happy to take good stuff, but how do I know if it's good? When you think about somebody like me or my investor friends or CEO friends trying to find professionals to lean on when it comes to supplements, or trying to find longevity doctors to help us think through medicine through the longevity lens. Do you have any thoughts? Do you have any advice as we're looking for professionals?
How to start taking your health into your own hands. I mean, this if you really want to start taking supplements or even other interventions, if you want to get into the world of biohacking, that really needs to take you need to be willing to get a little bit into the weeds of science. I mean, maybe at a deeper level than only investing. Now, let me give you a high level overview of the interventions. I would say that there are three types. The first one, as you said, is the supplements, lifestyle interventions that are readily available in Amazon, right? Then the second one is repurposed drugs that are already FDA approved. They have a reasonable safety profile, and they have some effect at the level of the mechanisms of aging. I'm just throwing names here, but I'm not recommending anything. But you may have heard of metformin, rapamycin, those kind of dasatinib, those kind of things, and some longevity doctors may be willing to prescribe those drugs to you, and they usually want to really help you understand all the risk-benefit profile of these interventions, and really basically present the evidence. You have in this small study, the drug helped them reduce this marker of inflammation, and this is good because of this and that. So you really need someone who's willing to do that with you. And then the third bucket of treatments, I think it's the whole preclinical and early stage clinical development things that is basically it's like hard biotech, right? All these gene therapies, cell therapies, new biologics, and that's coming. I mean, these treatments are in the translational phase, I really look forward to what the future holds in that space. I guess, we touched briefly on obesity before. Perhaps one of the first indications that these treatments will address is weight loss, for example, or muscle wasting. This perhaps even cognitive enhancement. These kinds of things.
So can we touch on this for 1 second? I mean, our whole life we've been told obesity is a health risk and stuff. I don't know that I've ever had somebody describe it to me as a disease, and I've never heard about the inflammation of obesity. Can you give us just maybe a little bit more on that?
Yes, of course. So obesity, for a long time, it was considered a risk factor for other diseases, a modifiable risk factor, which is something that your doctor, every time you visit, will tell you to lose weight, and even your parents, if they may even tell you that you're gonna be chubby, you have to lose weight. So the thing with obesity is that the excessive body fat that you start accumulating in the body has two downsides. The first one is that we became aware that fat is kind of a metabolic organ. It is not like fat only sits there. It really secretes some inflammatory molecules. And also, the thing with fat is that it imposes like a physical burden to circulation, because you need to supply more blood to that fat that you have, and also increases a burden in just your joints, your movement. Then when you get to a certain point in obesity, it's even really unpleasant for you to move, right? So it starts a cascade of behavior that ends up with you gaining more weight, and ends up with you gaining insulin resistance and diabetes, and then a stroke, heart attack, all of those nasty things. Sorry, you were going to say something.
Yeah, the word, Greg's got me reading all these books, and I get to do these great interviews with him on the mini series here. And I watch panels of all you experts talking about longevity stuff, and insulin resistance must be super well understood by you guys, because nobody ever explains it. How do you explain insulin resistance to like a regular person?
Oh yeah, sorry about that.
No, it's okay.
I threw in the word like that. Insulin is a hormone that produced by the pancreas that basically tells the cells that they need to use glucose, and so when there's insulin in circulation, the cell it takes the glucose in circulation and starts using it for whatever the cell needs to do. Right. So what's the problem with insulin resistance? It means that in order to get the cells to stimulate them to take the insulin and take them out of circulation, you need every time more levels of insulin. Right. So the pancreas, that is the organ that produces the insulin, needs to keep it up, right? To produce more and more insulin until it cannot do it. I mean, the body really needs to the cell really it's like yelling to a deaf person, right? The cell just cannot respond to the insulin, and then you start getting high levels of glucose in circulation. That is bad for a number of reasons, direct damage from the glucose and other mechanisms. And that's what we mean by insulin resistance. And now, what's the main organs that use glucose in the body? Obviously, muscles and the liver. Generally, having a good amount of lean body mass correlates with having a good insulin sensitivity. And yeah, that's insulin resistance in a nutshell.
And so if I have insulin resistance, I want you to tell me if I understand this right. If I have insulin resistance, and my muscles or my liver, whatever, aren't processing the glucose, it goes and becomes fat. Is that the point? Or what happens to it if it doesn't get used up? Or am I misunderstanding that?
When insulin doesn't get when you have insulin resistance, you have high levels of glucose, but it doesn't mean that it necessarily becomes fat. Yeah. In fact, what insulin, when cells have excess nutrients, and they take the insulin and they don't know what to do with it, they store it as fat, or it eventually becomes fat. So, sorry for throwing the technical term here, but insulin is an anabolic hormone. It means that it makes the body store things or construct things and synthesize them. Yeah.
And I apologize that I'm so uneducated in this. So is it that I want the body to use up the glucose, so I need it to have insulin sensitivity so that it can draw the glucose into the cell? Is that what I'm wanting to have happen?
Yes, you want the body to be sensitive to insulin, uptake the glucose and use it. And you want to have this. You have to have a certain level of physical activity, or you need to be able to use the fuel that you're eating.
Okay. And so, what's the bad thing that happens to the body when I'm not sensitive to insulin and I'm not using up the glucose?
When you're not sensitive to insulin and you are not using up the glucose, you are going to get fat. That's the short answer. And this is like a cascade, like a ball rolling down the hill and making it every time harder to respond to insulin until your body, your pancreas fails, and then you get diabetes, and you need to use an insulin sensitizer, like an insulin sensitizer or exogenous insulin, or one of the new glucose, one of the new weight management medications, right? The Mounjaros, the Ozempics. What these things do is that they increase the production of insulin in response to food in the body. So in theory, you will produce insulin, and but only when there's food in your gut. So this is basically what should be happening.
You know, my hero in life was my mom's dad, my grandpa, and he ended up with this and ended up with type 2 diabetes. And I saw how, unhelpful that was to his life. And then later, and he was like me, kind of like 6'3", big, lean looking guy. But, it seems like it contributed to him later needing quadruple bypass surgery and then stroke and his eventual death, And
Sorry
I
to
think,
hear that.
yeah, it's, circle of life. I believe I'll see him again, but after this life. But for me, what's magic about, so obviously I've got risk factors in my family, just being a descendant, right? And I've got certain family members who are dealing with that more or less. To me, what's amazing about Ozempic and the GLP-1s is this idea of like, wow, we've got the ability to help pull somebody back from the brink before the pancreas fails, before like in that pre-diabetes stage, you give them like a real help. And I realize it's not perfect and got to help with the muscle wasting and stuff. But I mean, I'm surprised that it is not more well known that those got initially approved for diabetes prevention. I feel like I'm completely missed by the news, you know?
Yeah, I mean, the question is, why did they make the news for obesity, but not for the actual treatment of diabetes? Yeah, good question. I think, this new generation of Ozempic and Mounjaro of drugs that them. Let me take a step back. The game with treating diabetes is not only controlling the glucose levels that shouldn't be that high. The game with treating insulin is preventing all the complications of diabetes, right? That is like the most significant clinical trial outcome you want to do, is like showing this treatment prevented heart attacks, this treatment prevented stroke, prevented diabetic retinopathy, chronic kidney disease, all of those things associated with diabetes. That's what the clinical trials need to do, and these type of medications are kind of doing it, but it took a while for them to start showing all these benefits. With the technical jargon here is pleiotropic benefits. It means that they affect different body systems in a protective manner, and yeah, this this is becoming. We're talking a lot of GLPs and incretin mimetics, but I mean, Ozempic is kind of like the first generation of these kind of drugs. Then the Zepbound or Mounjaro is a dual agonist, which means to say it activates two receptors in the body. So it's arguably a better drug, but there are a lot of drugs in the pipeline that may be even better, like triple receptor agonists and other sorts of improvements to the pathway. But that's incretins, right? That this is the whole insulin pathway. What's coming next after that is all the things that are not related to this mechanism of action, and people should start paying attention to that, and they are already paying attention to that.
Yeah, maybe going another direction. You brought up biohacking before, and it seems to me this big spectrum from like crazy nutcases over here doing things that are just silly, to like quite science-based, like reasonable things to be trying. And, there's these concepts where, people just getting their blood work done more often and working with a great doctor who can help them understand what they're looking at, and a feedback mechanism like feels more scientifically sound than some of the crackpot people. So let's say somebody listening today is interested in getting more into biohacking and they are willing to learn some of this stuff. What are some principles you would say for both safety and for effectiveness?
Safety and effectiveness of biohacking. Wow.
Yeah.
So obviously safety is the main concern, right? And the first thing that I would recommend doing is to check whether any intervention that you are considering taking interferes with a medication that you're taking for something else. I mean, that's obvious, right? And there are like online tools that check like drug interactions. So you really need to be careful with that. And then how to see whether something is effective. There's two components to this question, and I'll try to unpack them. The first one is looking at the evidence and looking at evidence-based medicine, which is like the 21st century medicine, right? And the second component is really looking at biomarkers. That is to say, at the way different parameters you can measure in your body to follow up on the intervention. So first one, evidence-based medicine. This is really you have to really do it in a case-by-case basis. You really need to be willing to analyze the risk, benefit, reward. I mean, some interventions are really inexpensive and have a reasonable safety profile, and you may want to go and do it, right? It's and I get it, and if taking that even helps you make other healthy decisions in your life, keep up with your with what you're eating, and keep up with your exercise routine. That's good in and on itself. That's good. So that's what I would advise. And then looking at the evidence, that's really a nuanced subject, because the thing with clinical trials and supplements is that the control groups are not always well done, or the size of the trial, that means how many patients you are following, is not big enough, or these are patients who are really healthy, right? Who are actually taking other things to take care of themselves, and that's how they got recruited into the clinical trials. So you really need to read between the lines, and be willing to go through the evidence with your doctor. And as I said, the level of scrutiny before taking an intervention really depends on the safety profile. Some interventions you may want to go really, really, really deep. Some it may not be worth it, and you may buy it and do it. And then the second thing, the biomarkers, which is a really exciting topic, and essentially you need to be able to see what the intervention is doing to your body, and there's different ways of doing it, right? Blood work, your own personal feeling. It's a subjective measurement, but it's very important. It's basically the most important. Then you may want to look at wearables. You may want to look at the more advanced aging clocks. And let me talk about that. There's two trends in clocks. That the trend in clocks right now is, in my opinion, is to look at organ-specific aging. And in my mind, this really makes sense, because it kind of relates to why some people get diseases of the brain, some people get diseases of the heart, some people of the lungs. So which body organ is going to fail first, right? And that's crazy, but there's an organ that will fail, and it may not be the same organ in every person. Maybe you have a different risk factor profile. Maybe you have genetic predisposition to a particular type of disease. So organ-specific aging, and this, in theory, this might be possible by looking at proteins in the blood, and only a number of proteins, by the way. You may be able to produce a specific organ age with 5-10 proteins. So there's that, and that's that. These kinds of profiles are coming. There's a hospital in Thailand that is already offering this kind of service with the blood. Then the second one is epigenetic aging, and again, sorry for the technical word, but it's this basically These type of clocks look at the marks over the DNA of your cells, and you have to trust me that there's a correlation between the pattern in of these modifications in cells and age, and it is possible to predict age based on the pattern of epigenetic modifications in the genome, and there are commercial kits available to measure that, and you may want to consider trying that. The next step, these types of kits are already looking at different types of organ ages. That's the trend that they're looking at different body systems of the age. And overall, the message that I want to leave you with is that you may not want to trust a single measurement of any type of biomarker, because health or rejuvenation or it's a physiological state. That is to say, it's a condition produced by the interaction of many factors that are functioning properly. So if you really get carried away by a single measurement, it's distracting, and you might be doing a disservice to yourself by only focusing on that. So yeah, have a comprehensive overview of your health, and a good longevity doctor will help you get there. They will instruct you on these types of tests.
Yeah, I was on a phone call yesterday with some folks at the Buck Institute out in San Francisco, and we've had Brianna Stubbs on the show, and the head of the Buck Institute, Eric Verdon, on the show, and he had actually just been recently interviewed about these different aging clocks, and his feeling was like they're not quite there yet, but if you do take multiple of them in aggregate, there's still information to be had, even if they're not accurate, but you could take multiple of them over time, I believe is where he was going with it. That like, it's still helpful, even though because you can take different ones and they could be off, 20 years, 30 years, and then the wrong direction. And then people want to take the number from the younger one, right? Whatever. But they're not precise enough, like you said, that you could just take one and believe it. But that doesn't mean they're not helpful at all. And I think about a friend. His company will do $100 million this year, and he found a great longevity doctor that helped it doing the blood work, looking at biomarkers, helped him solve these debilitating migraine issues and other things. Or we had a guy on the show who helped sell a company for about $2.5 billion. And what happens is all these guys off the show afterwards, we talk about longevity health and we talk about investing a lot in their companies, right? So he ends up telling me about he's got this great longevity doctor in Dallas, and a bunch of other of his friends have been going there, and this guy does a really good job of explaining what they're doing, and he's used them over time, and he's getting results, right? So my question is, there's so many charlatans, there's so much confusing information in the biohacking world. When somebody like me or my friends are trying to find a longevity doctor, what are some things we should look for, and what are some things that would maybe be red flags for us of we want to go with this individual or not?
Yeah, that's a good question. Let me comment briefly on what you said about the frequency of measurement, because that's really important. You and I missed that. You really need to, as you said, take a different types of measurements and try to do them regularly, or at least perhaps not every day, but maybe on a reasonable time, depending on the type of measurement. But the more kinds of data you have, the more chances you have of using one of the newer machine learning technologies to kind of make sense of the data and kind of find a pattern that you may have missed, that a human may have missed. Obviously, you have to supervise the machine learning, right? You don't have to trust the thing blindly, but it really provides a little bit of help. So I wanted to talk about machine learning and biomarkers. And then how do you trust a longevity doctor? I think the most important quality on if you're looking for a longevity professional is the capacity to communicate. If you have if this person is a good communicator, you may develop a good relationship with the person, and you will be able to get like a really rich and yet condensed view of the landscape of treatments available that you may want to take, and this person will help you understand your health and your health status. So really look at the capacity to communicate and really tell you all the nuances of all the treatments available. A green flag on that same line of thought is your capacity to the willingness to really go into the hard evidence and tell you, hey, this clinical trial found this, but it had this limitation, and you will eventually find conflicting evidence, right? The scientific world is full of conflicting evidence, and this person will help you make sense of it and really personalize, like customize the treatment for yourself. And the second green flag is the willingness to do all the biomarker monitoring with different systems. You may want to look at your VO2 max. Some people do that, your body composition, blood work, and maybe even advanced molecular diagnostics. And there
What's
are
an example? What's an example of an advanced molecular diagnostic?
Molecular diagnostics, we all these epigenetic clocks, for example, that's what we call a molecular diagnostic. You really look for a molecule attached to the DNA of your cells. That's a type. I would consider also these new cytokines in circulation, a type of advanced diagnostics. All these so-called proteomics or metabolomics, which is even metabolomics is the metabolites. So it's all the little molecules that get released by living. When the cells live, they release these metabolites, and these you can measure them. These kinds of things, and it's coming. You'll see this. There's companies trying to democratize access to these kinds of tests.
That's such great advice. It kind of makes me want to switch topics though and go back to the investor conversation.
Please.
So, by the way, congratulations on your interview series. I've enjoyed the Quadrascope YouTube channel and your interviews with famous longevity people like Nir Barzilai and Aubrey de Grey and all these folks. It's great.
Thank you for the kind words. Appreciate it.
I was thinking about one of the discussions that you were having, and your guest was saying that when they had gone to school, the biggest companies in the world were the energy companies, Shell, Exxon, these kind of things, and that nowadays it's these tech companies, the Googles, Google's, Apple's, whatever. But that there appears to be a bunch of evidence that the longevity industry could potentially pass it and could possibly become the biggest industry in the world. And whether that's true or not, there's a lot of investors that saw like all these promises about a preventative medicine over the years. And then finally Ozempic, the GLP-1s get approved. Goldman Sachs puts out the prediction they're going to sell $100 billion a year in revenue, right? Not market cap. And, it's like when Aubrey de Grey was saying 7-8 years ago, look, the Buck Institute started 25 years ago. Aubrey de Grey has been doing this for a couple of decades. There's been a bunch of people working for a long time. But then he said, it got real 7-8 years ago when the investors started showing up because, the evidence was there. Okay, this is getting close. And it just seems like now it's accelerating. When you think about LPs for your fund or just talking to investors in general, what do you think has changed that so many investors are now willing to put cash in?
Great question. What was the inflection point? I guess the inflection point was the accumulation of evidence that aging is a process that you can intervene in. That is to say, aging is a modifiable process, which is, if you really like think about it, it's a breakthrough in the term of how doctors look at risk factors. From when I went to med school, age is a non-modifiable risk factor because you cannot turn back time, right? but what you can do, it seems, at least in model organisms, is that you can reverse biological age. That is to say, you can fix or treat one of the causes of aging, and perhaps even stop it or delay it or even reverse it in very simple model organisms. So that awareness became a kind of more widespread. There's also been a big science communication effort in relaying these basic discoveries and making them digestible for the general audience. There is also, you also see every time older athletes and older actors performing perhaps superhero roles in their late 40s or early 50s. So people are becoming aware that if you take care of yourself, you can modify the way you age, and that has been common knowledge for a while. But now you see it. You see it if you pay attention. You see it every day. I think that's a big inflection point. And then I want to build on the whole preventive aspect of technologies. It's being preventive and being proactive, even more than having a preventive approach. It has really taken a center stage in medicine, because healthcare is becoming very, very expensive. It's going to be unsustainable if you don't take a preventive approach, and people know that. I want to throw into numbers. In the U.S., the U.S. spends roughly 1/5 of the GDP in healthcare. I think 17% of the GDP. Most of these healthcare dollars are being used by people in older stages of life. As the whole population gets older, this is gonna become unsustainable. This you really need to pay attention on prevention. That really is clicking into people's heads, I think. And then there's calculations of how much money would you save if you delay aging. And by delaying aging, I mean compressing morbidity, because older people get sick the most, and if you compress morbidity, you compress the time that you spend sick, right? And there's this recent paper by Andrew Scott. They estimate that extending healthy lifespan for 1 year will save you a crazy number like $38 trillion, and it's always a very, very big number that you will save by treating aging. And will this be a blockbuster industry? I think it will. As I said at the beginning of our conversation, the thing is that you will have treatments that can be used by both people who are sick and suffering from a disease, and people who want to prevent it. So to prevent it proactively. So right away you have a super wide number of users, and you have implications even on a deeper level, right? I mean, it's I don't like to talk about the emotional component of longevity investing, but sometimes it's like a personal thing that you would like to have your loved ones be around for longer, or you don't want your parents to get sick. You don't want to see them suffer, and there is a big emotional component to longevity that will obviously contribute to the general interest in investing there.
So let's talk about the investors that you meet. I'm talking to investors about this. You guys obviously do. Arguably, my guess is that most of your investors are not also MD PhDs. Hence the reason that they are looking to folks like you to help them diversify across a portfolio and hopefully have some big winners out of it. I'm interested. These, non-PhD, non-MD investors, what are they asking you guys when they're thinking about getting into your fund? What are the kind of questions they have?
Well, I mean, the first obvious question is, what are you guys investing in, and what is longevity? I think we already covered it, and we actually have a portfolio now, and we used it as examples. And a big question that comes up is what do you mean by treating aging? And there's two parts to that answer. The first part is treating aging means treating the mechanisms of aging. And I mean, perhaps this is not the time to unpack them, but there are different mechanisms that you can read about. People call them the hallmarks of aging, and there's more than that. So we have the treatment targets now. And then the second part of the question is, today there is not a regulatory framework for aging and aging for an intervention in aging, because there's a lack of biomarkers, and a clinical trial on lifespan is impractical, obviously. But all these companies are developing treatments for age-related diseases, and that's an important thing that people need to understand. And these treatment for age-related diseases will have likely multiple indications. As I said at the beginning, the key difference with longevity biotech and biotech is that longevity biotech, you can target multiple indications with a single treatment. And I think those are the key questions.
I feel like that's something I learned from you today that I had not really put together, is this idea that, it seems like such a problem that the FDA won't let you do a clinical test just for aging. But the side benefit of that is it forces everybody to come in for, a known target, diabetes, cancer, Alzheimer's, and then back into also this might make you live for 10 years longer, right? So by default, it's forcing you to have multiple applications for this thing, which, as you brought up, is so common in the blockbuster drugs. And obviously there's the drugs that make good money, and then there's the ones that make the billions or billions and billions, right? And, it's funny, I got an email from Greg just a few days ago about some of the new things that some of the GLP-1s are potentially being considered for, and those potential profit numbers are even going up. A question about risk reduction. Okay, so these investors who are thinking about getting into longevity funds, obvious risk reduction is diversification. Being honest about the statistics of how often this stuff works and having enough, shots on goal that statistically you should be winning. Management teams, having these experts, people like yourself, people like your partner and other team members at Quadroscope, who they have the sector expertise, they have the technical background, they have the connections, things like that. What other advice would you have for investors who are thinking about buying into longevity funds? What else can they do to feel confident in selecting which funds they want to get into? What can help them de-risk that choice?
Yeah, that's a complex question. How to de-risk your investment into a fund? By
Because
definition,
different funds have different performances, and so
yeah,
what are
yeah.
indicators of a lower likelihood of failure and a higher likelihood of success?
I guess the biggest you have to look at how different funds look at longevity, and as you said, it's not always the same kind of strategy. And perhaps the best way to understand how a fund understands longevity is looking at the portfolio. And maybe if you are considering investing in a fund, and the fund already has a portfolio, you will look at, hey, what kind of decisions the team made in the past. Are these companies I feel excited about? Because the team will likely invest in similar companies. I would also ask about the decision process of the fund, which is not always evident. How's your deal sourcing? How do you access the deals? Do you really take the time to connect with the founders and try to understand the technology? You may want to ask you may want to look at them at obviously the advisory board. Are these people in a position to actually contribute with something useful into making investment decisions? Are they business oriented? They're science oriented, and there's always a balance, right? Those two things: the decision making process and the portfolio.
Yeah, that's great. We've covered a lot of ground here. But maybe before we move past investing, for people on the fence who, maybe they made their millions in tech or real estate or something, and they're seeing what's happening in the space, and they're seeing what a big upside there is and how they could be diversified by being in a fund. And they're on that edge, and they're really considering it, but they're not quite sure if they're ready to commit. What's maybe one or two things that you would say to maybe encourage them to put, 1% of their net worth into it,
The thing that I would say is that the longevity industry, it's one of the few transformative industries in the way that they can really change how you live your life, right? And very, very few things do that. Cell phones are one of them. The motor engine, that's another. Internet, and
AI.
And if we get to have true longevity treatment, something that is safe, that has an immaculate safety profile, and that reverses aging, and that you can start taking, for example, when you are 35 or not, you feel that your performance is declining, and you want to increase your health and delay diseases. If you had access to that, that will really change how you live your life. And yeah, it's a transformative industry.
Yeah, that is interesting to think of putting it that way. You look these days, we got AI, if fusion maybe became commercially viable, if, quantum computers get over the hump, it looks like they'll get over, like space mining. I don't know, like if Elon Musk can get us to Mars,
Space exploration.
Do you know what I mean? Like some of the science fiction stuff, if that becomes, safe and affordable, could drastically change the way of life for huge portions of the globe, right? And there's probably a large financial return in that. Yeah.
Absolutely, it's something that if usually if you feel excited about using the product, and everyone feels excited about using the product, it's going to be something transformative.
Yeah, I love it. Well, I appreciate you spending so much time with us today. This has been so great. I know we went longer, and so I appreciate you saying that we could.
Thank you for having me. I really enjoyed our conversation. Thank you for the nice questions.
You bet. Bye, everyone.
Goodbye.